Good afternoon, intermediates, and welcome to our second week of growth and development. Our topic for this week, contraception. Before we proceed, though, I'd like to make a comment about last week's assignment. I know many of you messaged or emailed me letting me know that the codes were not working for the mentimeter.com word cloud. Thank you for your messages. I am aware that it's not working. I did make an announcement at the beginning of the week letting all students know that they were no longer responsible for that portion of the assignment. So don't worry about it. You're only responsible for the table comparing the healthy and unhealthy relationships against each other. I did look at many of them so far. They look great. I will have those marked and returned to you by the end of the week. So thank you. So, contraception. What is it? The official dictionary definition of contraception is the deliberate use of artificial methods or other techniques to prevent pregnancy as a consequence of sexual intercourse. For our purposes, I'm going to change that a little bit just to add in sexually transmitted infections because those are also a very real risk involved in becoming sexually active, and contraception. Many contraception methods are an effective way to avoid sexually transmitted infections, which we'll talk about. So thinking about and discussing contraception should happen on both an individual and a couple's level. So an individual should be aware of all the different choices and options they have in regards to contraception, and that is something that I will talk to you about today and provide you information. An individual should think about and make a plan based on their own beliefs in regards to becoming sexually active, their own feelings or desires, and their own unique personal situation. Many of these factors we talked about last week in regards to healthy relationships, and they do absolutely connect into the topic of contraception as well. Again, one of the things we talked about last week was the importance of having an open dialogue with your partner. Healthy relationships have communication, and couples should certainly be communicating about contraception. They should be talking about consent, timelines for potentially becoming sexually active, and their own plans versus their partner's plans and how those align or perhaps differ. These are important things that should not be avoided in any relationship. So, some things that couples should talk about when having this open communication is the risks involved of becoming sexually active, because there are very real risks, such as pregnancy. I'm sure you all understand the biological mechanisms involved in pregnancy, but if a sperm reaches the female's egg, then pregnancy occurs. This can be avoided through contraception methods, which we will talk about. Another risk is sexually transmitted infections. Sexually transmitted infections are a risk once becoming sexually active, and some of the contraception methods that we discuss can prevent STIs, but not all. Couples should be openly communicating their thoughts, feelings, and emotions, and they should not feel afraid to do so. They should also fully understand where they can turn for assistance, to have their questions answered, or for guidance. I will provide you with resources as this unit progresses to help you out in that area, but we did already discuss the importance of having older people in your life who can act as a support system to provide guidance, assistance, and ask questions. Couples should also be openly communicating their plans with each other. Your own plan should not be a mystery to your partner, and you should decide upon plans together as a couple. The reason for this is to avoid a potentially difficult situation. As a relationship progresses towards potentially becoming sexually active, you need to remember your own personal plans and ensure that you instill those in the way your relationship progresses. You should never, ever feel pressured or obligated to engage in sexual acts to please your partner. This directly connects back to last week's conversation about consent and the importance of it. And a supportive partner will understand and be willing to discuss your feelings and delay sexual activity if necessary. So we will talk about the different methods of contraception, but I want to be clear that the only 100% effective way to ensure the avoidance of unwanted pregnancy and sexually transmitted infections is abstinence. Abstinence means to avoid having sex. No method of contraception is fail-safe. They all have risks and side effects and drawbacks. The only guaranteed method is abstinence. As it says, abstinence never fails. So if you are unsure or nervous or still have questions, you can never go wrong with abstinence. So there are many contraception methods, including condoms. There are both male and female condoms. I'm sure many of you are much more familiar with the male condoms. They're much more widely used. There's the birth control pill, which is a female form of contraception. They are pills that are taken every day, which provide a hormone to the female, which prevents ovulation from occurring. So if sperm does happen to enter the woman, there are no eggs for fertilization to occur, and pregnancy cannot happen. IUD stands for an intrauterine device, and this alters the uterus in a way that prevents pregnancy. Implants, injections, and patches are all ways to provide the same hormone that the birth control pill does, just different methods of providing that hormone. So an implant is implanted under the skin, and it on a regular basis will excrete the hormone into the female's body. You can also have the hormones injected, or very much like the nicotine patch, it can be worn on the skin, and it slowly excretes the hormones into the female's body. All of these methods of contraception have benefits and drawbacks, and I can't stress it enough. The only 100% effective method is to abstain from sexual activity altogether. Some of these contraception methods can cause changes in your body, such as weight gain, weight loss, acne, irritability, anxiousness. The side effects differ from individual to individual, so it's important that you research and understand them and the way they will affect you prior to taking them. Some of them may take time, longer than others, to take effect. Some are more permanent than others, and some have a cost. So these are all things that you need to discuss and think about prior to becoming sexually active. Oops. So contraception is, as it says there, a big decision. It's not something that should be taken lightly, and couples should be thinking about it and discussing it regularly. It's a sticky subject and may not be easy to discuss, but it is a discussion that needs to be had, and probably not just once. This is an open discussion that should be had over a long period of time. So the two most commonly used methods of contraception are condoms and birth control. So I'm sure you all understand the biological mechanisms of pregnancy. If a sperm reaches the egg of a female, pregnancy will occur. The condom offers a barrier. It slides over the penis, and it provides a barrier which prevents the sperm from reaching the egg. Thus, fertilization cannot occur and pregnancy does not happen. Condoms are also effective methods of contraception for avoiding sexually transmitted infections for the same reason. Because of that barrier, it prevents any bacteria or organisms from getting or being transferred between partners. So condoms will boast on the package a 99% effectiveness, which is great, but it's important that we understand that that is under perfect conditions. And as we know, conditions are not always perfect. Condoms can break, they can be applied incorrectly, and these are factors that need to be considered when talking about the effectiveness of condoms. And if you do take all of those factors into consideration, condoms are more like a 91% effective, which is great, but you need to be aware that they are not perfect. Birth control pills are the most common form of contraception taken by females. And what it is a pill that is taken every day. And this pill, as I mentioned before, provides a hormone to the female body which prevents ovulation from occurring. So if by chance sperm does enter the female body, there are no eggs for fertilization, thus pregnancy is avoided. So each of the white pills all have the hormone in them. So after you take them, your body, as I said, it will not ovulate with this hormone inside of it. The red pills are placebos. They do not contain the hormone. They're just like kind of sugar pills. And what essentially those are is that is the week that the female will ovulate or go on her period. When the hormone is not present, it triggers the body to then release the eggs and ovulation occurs. So those are the two most common methods of contraception used today. So we are on to our task for the week. It's quite simple. I want you to create a Google Doc, which you'll share with me, and please provide 1 to 2 paragraphs of writing on the following question. What do teens need to know about relationship safety, contraception, and safe sex practices in order to protect themselves and their personal limits? If you're stuck, I want you to consider reviewing last week's slide presentation as well as this week's. Most of the information that you need is in those. Another way to think about it is if you were in my shoes, if you were a teacher teaching teens your age about this topic, based on what you've learned over the past 2 weeks, explain to me what you would deem important to teach those kids. What have you learned in the past 2 weeks that is important and you think